Hello, good morning, good afternoon, good evening, guys. Can you hear me?
Yes.
There are almost 28 participants, and I can only hear one participant. Can you guys please be interactive and be responsive during this whole process because this has been arranged for you? All guys, and I'm here to help you guys to understand what exactly this whole process of MRCP is, how you have to prepare. So just please be more active, be more and participate more during whole of this webinar, so that I would be able to help you in a better way. Okay.
Sure.
That's great. That's great. So I think it's already a time. So we will be just starting now with our uh, webinar. So again, a very, very warm welcome to all of you guys. My name is Dr. Josefa Salim, and I am a GMC registered Department of Health Abu Dhabi registered doctor, and I'm working as an emergency registrar. And today I'm here to talk to you guys about MRCP. What is MRCP UK? And what is required from you guys to pass it in first attempt with flying colors? Okay, so um, we will gonna we will gonna be concentrating more on MRCP part one. But first of all, I will be giving you the review about what MRCP is, how many parts, what it is required from you, what is the eligibility criteria, and so on and so forth. But the main purpose of this webinar today is that how how you guys can prepare for MRCP1, how you guys can apply for MRCP1. Like the main purpose and the main focus today will be MRCP1. Okay, so before moving further, I will be telling you guys that in between the webinar, in between, I will give you time. I will give you guys time to ask me questions, whatever you have on your mind, whatever you want to ask regarding this. So please be patient and jot down your questions, whatever thoughts that are going on in your mind, and I will try my best to help you guys in answering those questions. Okay, so um, at the end of this session, after we have after we will be just discussing about MRCP, there is a very, very brief and concise presentation about one of the topic from MRCP, dementia. And after that, what we will be doing is that I will be telling you that how this topic of dementia, it's just an example for you guys to let you guys know that how MRCP1 works and how you will get the questions in MRCP1. Okay, so after the questions, after the presentation, there will be some sample questions, and I will gonna show you guys that after my presentation on dementia and the way I'm gonna tell you to approach this topic, then I will be giving you some sample questions, and you guys will gonna answer those questions, and you guys will gonna tell me that how easy it was for you guys after my presentation, that that you were giving the answers correct or not. Okay, and in the end there will be an open house, floor will be open. Anyone who wants to ask question, anyone who wants to give any suggestion, you guys are most welcome. So moving further, the main agenda objectives, I have already told you guys what MRCP is, steps of MRCP exam, structure of the exam, how to apply for the exam, and available exam centers, preparation resources, how to pass it in the first attempt. That's very important. Then I have told you that we will be going on to the presentation. We will be going straight forward to the questions and strategies to solve those questions, and then we will be having an open discussion and question and answer session. So guys, this is gonna be a long ride, so bear it with me please, and I'm gonna be very concise, very to the point, but it will take some time. Okay, so let's just understand first what is MRCP before going into the exam. Guys, what you have to do is that you should always know that what is the exam about. what is the structure of the exam, because planning is very, very important. Not only the study plan that you should have, you should also know that what you're gonna get after passing this exam, and you should also know that what is the financial burden which this exam gonna put on on my finances. So it's very, very important to manage and to plan everything before going for any exam in your post graduation career, because nowadays exams are a bit expensive, exams are a bit tough. So that's why we have conducted this session. So I'm just I will tell you each and everything about this exam, and how you will gonna pass this exam in your first attempt, and you can like if I can and other candidates can, then you can also pass this. Okay. So, MRCP UK exam, it is basically there are it is for UK as well as it is for Ireland. Okay, so I'm gonna talk about UK today. So, first of all, let's talk about MRCP UK. So, MRCP UK is MRCP Part One. Then we have written MRCP 2, and the Part 2 is clinical, which is practical assessment and clinical examination skill, also known as PACES. Okay, so let me tell you guys that if you guys are in UK and you are foundation year and you are in foundation year 2, and you want to join the training program there, so this is the outline, this is the structure through which MRCP works and through where you have to take the MRCP. So if you are in a foundation year 2, what you will gonna do is that you will fill up the, I'm just telling this about UK candidates, and later I'm gonna tell you guys about the international graduates who will be giving MRCP and how they will be incorporated in this structure. So after completing the foundation year 2, what you will gonna do there in UK is that you will gonna get your competencies signed for getting into your training program. This is IMT training. It is for 3 years. During these 3 years, you have to complete your MRCP UK, including all of these three parts, part one, part two, and part three, which is the PACES. It should be completed in these 3 years, and only then you will be able to move on further to the specialty training program, which is of 4 years. Okay, and then you guys what you guys will gonna do is that if you have done your specialty of 4 years, then you will gonna move on to the CCTT, which is a credential for the specialist procedure. Okay, so what if what if you are an international graduate? So if an international graduate, for an international graduate, what going to happen is that if you have done MRCP UK complete, you will be recruited as a registrar there in the NHS. Okay, as a registrar. So the registrar, if you want to go further to the training program, what you have to do is that there will be a competency form which you have to complete. Actually, what exactly it means by competency form is that there will be certain boxes that you have to check, and it should be checked by your supervisor that you have got these competencies. If you have got all of those competencies, then only then you can apply into the program of training. Okay, uh, if you haven't got it signed, most of the candidates that are international graduates, IMGs, what they usually do is that they get their MRCP. They got registered with the GMC through the MRCP pathway. They are recruited there as a registrar, and then they get their competencies signed by the supervisor, clinical supervisor, by their clinical lead, and then they apply for the specialty program. So this is a very, very brief brief pathway which I really wanted to tell you guys, because most of the candidates, especially the international graduates, they don't know how MRCP works. Like if you have passed MRCP, where you will gonna stand in NHS. So this is how it works. Okay. So let's just start with the MRCP UK 1. I will be telling you that MRCP UK 1 exam, it's an entry level exam. And let me tell you guys that you need at least minimum of 12 months of postgraduate experience, like house job here in we have 12 months, right? It's 1 year, so that's what it is, 12 months. After the house job, you're eligible to appear in MRCP UK1. You cannot appear in MRCP UK1 after completing your graduation. You have to have experience of 1 year. Okay, so, and the second thing, you cannot take MRCP part 2 first or an MRCP part 1 later, like the USMLE steps. That's not how it works. Okay, here you have to take MRCP 1 first, and only then you are eligible to go on to MRCP UK2 written. Okay, so the next thing is that how is the exam, what should you expect on the exam day? So it is a 1 day exam. Okay, then it is a actually 1 day exam, and it is 3 hours, 1 hour break, and then 3 hours, so total 6 hours. The exam is of 6 hours, 3 hours paper. First part, like in the paper there will be one, and part two in the exam. Okay, so um, each paper will contain 100 multiple choice questions, so total of 200 questions in MRCP 1, 100 in first half, 100 in second half, and total of 200 questions. Okay, five there will be five distractors, and those distractors, let me tell you guys that they will be very, very closely related to the stem. Like, you will think that this is also right, this is also right. How come they have given all of these options in a single question, which all are closely related? But let me tell you guys that there will be only one answer that will be the best answer, and that will be the correct answer. That's how MRCP is. It's a really confusing exam. It is really, to be very honest, to be very, very honest, it's a tough exam. Okay, but with proper guidance, with proper help, and proper study plan, you guys can ace this exam with flying colors in first attempt. Okay, because there are very, very certain key points, there are very, very certain techniques that how you have to approach each question, how you have to approach each topic. Okay, so don't worry, we will gonna talk about it later in our presentation. So um, you can take it online on your computer from the ease of your home. At the same time, it's an pen and paper exam. Like, there will be, you will be given a paper, a sheet, and there will be bubbles, like we all have been filling since long time. So you have to fill the correct answer. Okay, so this will be the pen and paper, and it will be in the exam center. You have to go to the exam centers. There are different exam centers. We will gonna talk about that later. So the good thing is that this exam, no negative marking. So you should attempt each and every question, even if you are not sure that what the answer is, because there is no negative marking. Okay, and it is a pass or fail exam. By pass or fail, I meant is that though there are marks for, like, when you will get your result, you will be given certain marks for it. Okay, but those marks are just your perform. It will not affect in the recruitment process or in getting a job, like in USMLE before in USMLE, they were like, the better your score is, the better you have the chances to get the match. But now it's also pass and fail. Similarly, in MRCP, it's just pass and fail. Either you are pass or you are fail. Okay, so the last part, which you can see here in this box, it's very, very important for you guys to note. You can see that the passing rate of MRCP1 is only around 30 to 40%, and the pass marks are 940 out of 999. Total marks are 999, and the passing marks are approximately, okay. It's not hard and fast rule that every time it will be 540. No, it depends upon the exam. Actually, how the marking system works in MRCP part 1 and part 2 written is that it's an equating system. There is no very clear cut, like they haven't given any clear cut way that they are marking it, but they said that it's an equating system. Like on, it depends upon like how the candidates has performed in every question and what is the difficulty level of that question. If the question is difficult and the less number of candidates have attempted that, marks of that question will be more. And if it is an easy question and a more more than a certain number of candidates have attempted that correctly, so the equivalent marks will be low. Okay, so we don't know exactly how it works, but this is how it is. Like it's an equating system, and that's why the marks are 999. Though you have 200 questions, but you can't justify how the marks are 999. So it's just an equating system, and from that you have to approximately get 540, and the passing rate is only 30 to 40%. See how low the passing rate of part one. Again, I'm going to tell you guys, and I'm going to emphasize it again and again, that MRCP part one, it's not a simple exam, and it's a difficult exam. But you can say is that it's more of a technical exam. If you have studied with a proper approach, your approach is good, you know how to approach the question, you know how to retain the information, because a lot of information out there, a lot. You guys or me, no one can retain that much amount of information, because like there's no specific there's no specific syllabus from which the exam will gonna come. They haven't categorized that we will gonna give you we will gonna give you the exam from these particular topic, from these particular textbooks, or from these particular, like no question will be out of it. No, they will just gonna give you a outline that this is the specialty. From this specialty, this much number of questions will come, which we will gonna discuss further. So that's why it is very important to plan and to set yourself in a way that you have to pass this exam in the first attempt, because the passing rate is already so low, and the exams are getting more and more expensive day by day. And the most important thing is the time. Time is money. If you're gonna fail the exam in first attempt, as you know that there are a lot of competition after COVID, there is a big backlog. Students are not getting the seats for appearing in the exam. So you will gonna get the seat for the maybe for after 3 months, 6 months. So you have already wasted that much of your time. So it's very important to plan your things accordingly and to know what you are going for. Okay. So guys, these I just took this screenshot from the MRCP website and the Royal College of Physician website, and this is the upcoming these are the upcoming dates for the exam. So exam is like they are conducting the exam 4 times a year. Okay, so in 2024 the first exam will be in January, second will be in April and August, and the last one will be in October. Okay, so and further, please have a look at this. Have a look at this. These are the numbers. These are the amount of money you have to pay for this exam. £460 for UK candidates, the one who are in training or the one who works there, and those who are international graduates, they have to pay £616. And for people who are here from Pakistan, uh, roughly almost £616. They are almost 2 lakh 25 to 30,000. So guys, you can imagine how expensive this exam is, right? So you have to plan. That's what I'm saying. That, and you can see that the time as well. You can see the time as well. You will not gonna, if you are thinking that God forbid someone just failed the exam here, they can get the next seat. No, because what happened is that if you guys gonna look at here, if you guys can please look at here, this is the exam date, 24th of January, right? And the result will be by 23rd of February. 23rd of February. So the next diet, like basically the next attempt in MRCP, we called it diet. So don't get confused, okay? So the attempt is also known as diet. So the next diet is in April, but please have a look at it. The application window in which you can apply for the exam is 5th of February to 12th of February, and your result is on 23rd. So you have already missed this attempt. You cannot get this diet because you cannot apply. Your result is not out yet. So your 3 months are wasted. Your next will be in August. Almost 7 months. See, that's why I'm telling you guys, it's really important to plan everything beforehand. In respect of money, you can see it is very expensive. And time, which is money, it is, you can see that you cannot book the next diet. They have planned these things accordingly. Like the result is on 23rd, that next diet period, window period is 5th to 12th. So you are not eligible to apply here because you have already given the exam, and you don't know that what your exams results are. So you cannot apply for here. You will have to apply here in June. Your result will be in Feb, and you will only be applying in the June. March, April, May, June, 5 months. And your exam will be further on 14th August, like 8th month. I hope that makes sense. So next is the exam centers. Let me tell you guys that now it's really convenient that exam centers are throughout the world. Even for the PACEs, we have exam centers in India, Pakistan, in Middle East, Saudi, in United Arab Emirates, and so you guys can fly anywhere if you want to go nearby your countries, wherever you are staying. So, excuse me. Anyone is asking a question? Please, guys, please get yourself muted so that there is no distraction and we are able to finish this on time. So it's a request. So please mute yourself. Thank you. So these are the list of exam centers. You can just go through them, go through the list, and you can see that which exam center is for you. So now the next process, like how to apply for MRCP Part 1. First of all, I have told you that you should have at least 12 months, 1 year of experience after house job. Only then you are able to apply. Then if you want to apply, what you will gonna do is that you will gonna go to the Royal College of Physician. When you will Google MRCP, okay, it will redirect you to the Royal College of Physician website. There, on the right hand corner up, you will find my MRCP account. So you will open at this, you will gonna make your MRCP account. Okay. So when you are going to make your MRCP account, sometimes let me tell you guys that there is a problem, there is a glitch, whatever you want to say, that you will not be able to make the make your account if your email address is from Gmail. Sometimes it happens. Okay, it happens sometimes. So try to make your account with Hotmail, with Outlook, whatever, or any other email address. With Gmail, I faced that problem, so I have to make it with the Hotmail account. So please, if you find something like that, you can make it with Hotmail. No worries. So then you will gonna complete all of the details there, your address, your personal details, and all the other mandatory questions they will be asking you, and you have to fill all of those questions. Okay, once you are done with that, what you have to do is that they will ask you whether you are training in UK or not, because if you are training in UK, they will be asking you for your GMC number, they will be asking you for certain other questions, and of course their exam fee will be less, and I have already told you, and it will be directly connected to the GMC, so they will gonna send the results and everything like that. Anyways, so for that, if you are an international graduate, you will say no. then you have to choose the center where you want to sit for the exam. Okay, then if someone has some special arrangement, like someone has some there will be details about what special management arrangements they are talking about. So you can please go through it. If someone has, if someone are differently able or something else, so you can just go through that and you can just go through the arrangements. They will gonna arrange it for you if you guys are eligible for it. Okay, then you have to pay for the exam. So how you can pay for the exam? You can pay directly through your debit or through your credit cards, and you can also pay in a draft. So I would really recommend you guys to pay for with the debit and the credit card, because this process of draft and everything, it's a very hectic and lengthy process. Nowadays everyone has credit cards, everyone has debit cards, so please pay through the debit card. So it's very much easy, and your payment will be instantly accepted, and you will get an email that your amount has been deducted and you are eligible, and you will gonna get further details by the Ars Royal College of Physician later. Then once your application is submitted, okay, you will be assigned an RCP code, the Royal College of Physician code. Okay, because this is the code, like you everyone get a roll number. When we are appearing in exam, we have a roll number. So this is the roll number, Royal College of Physician code. When you will be going into the exam, you will have to fill you will have to write these Royal College of Physician code, and it's with you for life. Okay, so then the last and the important step is that once you are already done with all of the above mentioned steps, they will send you an email, and they will tell you that please email us your primary medical qualification, which is your degree. Okay, which is your degree, and scan it, and it should be attested. Now the question is, who can attest the your degree? So it can be any notary, which is like any justice, like that. It can be attested by your university. It can be attested by your principal. It can be attested by any MRCP holding MRCP physician. Okay, it can be attested by anyone who has already completed his MRCP. Okay, so they can just attest it, and they will gonna send it to you, and you guys have to scan it, and you it's like you have to send a copy. Okay, email them. Before they were accepting it through post, but now they only accept it through emails. So just send them an email with the attested copy of your degree, and you guys are good to go. After sometimes, you guys will gonna like maybe 3-4 days or 1 week, you guys will gonna get an email that your primary qualification has been accepted, and you will get the details of your center and your timing and everything 4 weeks before the exam date. Okay, so this is the important part. Now we're going to talk about the exam format. So let me tell you guys that this exam format, as I have already discussed whole of this thing with you before, 2 papers, 5 options each with 100 questions each. Okay, this is important. Um, what they will gonna assess you for? They will gonna assess your knowledge, your comprehension, also assess the ability to interpret information and to solve clinical problems. Okay, so these are the things they will be assessing you in the MRCP Part 1 exam. And this is what I was talking to you about. The 4 distractors are closely related to the preferred option, but less correct. They are not saying incorrect. Let me clear it for you guys. They are not saying incorrect. They are saying less correct. Okay, so that's why the exam is very confusing, because you will gonna think that, okay, I have read, I remember that I read this thing before and this topic, but it was there, it was also there, which is the correct answer. So it will be, there will be a key point, there will be a distractor, there will be a catching point in the stem of the question. which will gonna differentiate all of those four less correct options from the one which is the preferred one. Okay, so you have to choose the best answer from the 5 possible answers. Okay, and every this exam and this question will be awarded with 1 mark, and there is no marking, negative marking. Okay, though they are saying that 1 mark, but it's not actually 1 mark, because how if it is 1 mark, then 200 questions, the total should be 200. So it's just an equating system of 999, and they will gonna uh, roughly they have a system of calculating those answers. Anyways, so moving further, on your right side you can see that there is a list of specialities on which you will be assessed in the exam. Okay, so let's start with this. So first of all, it is cardiology. You will have approximately 14 number of questions. So let me tell you guys that these number of questions, they are not, it's not a hard and fast rule that you will gonna get 14 questions from cardiology. That's not true. Sometimes the number may vary. Okay, so don't stick, oh, how come they have told me that it's from cardiology, like there will be only 14 questions, but in the exam there were like 18, 20 questions from cardiology. So you cannot challenge them, because they have already told you that they should be taken as indication of the likely number of questions. The actual number may vary slightly. Okay, so it's just to tell you guys the importance of the specialty. Like if like cardiology, it's a major specialty, and we will gonna get 14 approximately, not 14, approximately 14 questions. Then there is clinical pharmacology and therapeutics. We're gonna get 15 questions. Clinical sciences. So let me tell you guys that in MRCP1, there is a portion of clinical sciences. In clinical sciences, they will gonna check your basic knowledge. Okay. In MRCP2, it's totally clinical. You don't have the clinical sciences part. But here you will gonna have the clinical sciences part, because they will gonna assess some of your med school knowledge and some of your postgraduate house job knowledge, that how much you have gained, how much you have retained up till now. Okay, so the clinical sciences, they have given the table below here. If you can please concentrate here now, they have given the table here. So you can see that in clinical sciences, there will be clinical molecular and membrane biology, clinical anatomy, clinical biochemistry and metabolism, clinical physiology, genetics, immunology, and statistics, epidemiology, and evidence-based medicine. So you guys, you can see that they have only 2, 4, 3 questions, like less number of questions. Okay. So I know you guys will gonna like you will the question that you guys will gonna have right now is that only 2 questions or 3 questions from the clinical physiology. How can I read whole of the physiology in 3 to 6 months? Then clinical anatomy, only 3 questions. And anatomy, oh my God, I know it's so tough, so lengthy. How I'm gonna get through all of the clinical anatomy? So that's why we are here to help you guys, and we're gonna help you with that. And you guys can can have approach through which you can only study the important topics which has already been repeated in the exam, and the questions that has already been repeated there. So you have to study only those. Okay, but moving further, we will going to help you guys with that. Don't worry about that. Okay, but keep in mind that clinical sciences, some basic questions, maybe mechanism of actions, maybe the immunoglobulin, maybe the immunological problems, they will be there. Okay, and to be very honest, this part is the toughest part, I think, because it's a basic. It takes you back in your first year and second year of MBBS, so it's a bit hard. Anyways, the next is dermatology, 8 questions. Endocrinology, gastroenterology, and hepatology. Then we have geriatric medicine. Geriatric medicine is actually the medicine of the old people, like old medicine. Then we have the hematology, infectious diseases, neurology, oncology, and please just have a look on the number of questions they are having. Major specialties will be having major number of questions, and they will be playing a major role in the exam. Excuse me, guys. Guys, please check yourself. Please be on mute. Please be on mute. Everyone, please check your mics, please.
ചങ്കുവേദന ഉണ്ടോ? ഇവിടെ തന്നെയാണ് വേദന. ഇവിടെ ചങ്കുവേദന.
Okay, sorry for the interruption. So moving further, what we will be doing is that we will be seeing that the medical ophthalmology, from the eye, there will be 4 questions. Palliative medicine and end of life care, 4 questions. Psychiatry, 9 questions. Renal medicine, 14. Respiratory medicine, 14. Rheumatology, 14. Total 200 questions. So let me tell you guys that if you are thinking that the ophthalmology or this geriatric medicine, they have less number of questions, so we will gonna skip these things and we will not gonna give importance to them. So that's where the equating number system work. They have 4, like ophthalmology have 4 questions, right? So the 4 questions will gonna make 100% of the ophthalmology, because when you will gonna get your exam results, you will get the number of questions that you have solved correctly in each domain. Like cardiology, you got 70%, ophthalmology, you got 20%, or like this. Okay, so let me remind you guys that in cardiology, 14 questions will be making 100%, and in ophthalmology, 4 questions will be making 100%, and these 4 questions weigh more than these 14 questions, and they will gonna contribute more in your total score than the cardiology one. I hope that that makes sense to you. So that's why they have created this type of numbering and marking system, that you cannot skip any of the topic. If you will gonna skip any of the topic, it will, and you think that that topic has less number of questions, it will gonna affect your total score very bad. So you have to go through each and every topic. I know these are at almost total of 17 specialties, and you cannot imagine that how much information you have to retain. And the only thing that will gonna help you pass this MRCP exam is your revision. It's not like you have only studied one time and you think that you will gonna reproduce there in the exam. No, it's the revision, and it's the way you have approached the topics. It's the way that you have, because when you will gonna start studying, you will see that every topic is so lengthy, and it's whole of the medicine. How can you remember all of the medicine, especially the guidelines, nice guidelines, BTS guidelines? Every topic has a separate guideline, and the exam is totally from the guidelines and from the latest updated guidelines. So that's where smart study comes in. How you have studied, how you have approached the topic, how you have like, if you will gonna start from A to Z, let me tell you guys, you will not, even 1 year will not be enough for you to prepare for this exam. Okay, so that's where your approach kicks in, that you have to be very systematic with your time, with your approach to study, the approach to learn the questions. What are the key points? If these key points are in the stem, in the question, then this can be the answer. These things will gonna make more sense once we are heading forward. So let's just head forward. So guys, this was the path for MRCP part 1, and now I'm gonna, if anyone wants to ask any question up till now, please raise your hand, and one by one I'm gonna answer those questions, and then we will be moving forward. Okay, so the floor is open, please. Anyone wants to ask any question? Any questions? Hello?
No question for me.
So guys, I'm gonna ask you again, any question or we should move on further?
Hi.
Hello, doctor.
Hello, it's Dr. Paul?
Yes, Dr. Paul.
Yes, doctor. How are you doing?
So, yeah, I'm fine actually. So, in my case, I have recently cleared my PLAB exams and I'm currently applying for jobs.
Yes, yes, I'm hearing you.
So, yeah. So, I was thinking that if I give MRCP, will it increase my chances of getting shortlisted?
That's the question of every candidate nowadays. But let me tell you guys that with the increasing competition and with the every passing day, you know that the competition is too high nowadays. And
Yeah,
having MRCP on your CV is a big star. Though there are other criterias as well. You should have a audit, you should have a research, you should have a teaching experience, you should be involved in other activity. But let me tell you guys, if you will gonna go through the exam, if you will gonna go through the ads, that the jobs that you are applying in nowadays, they have mentioned that having MRCP is, even some trust, they are mentioning that it is essential
yeah, that's what I have
for the
noticed,
junior
most
jobs
of
as
the
well.
jobs.
But in every single NHS job, it is a desirable, and you will gonna get more scores in your interview if you have already passed MRCP. And to be very honest, if you have done the MRCP, even part one, let me tell you guys that it will gonna give you so much confidence because you will be having a lot of knowledge. PLAB exam is a basic exam. If you have done MRCP, PLAB is nothing in front of you. Okay, PLAB one. So having MRCP is a big star in your CV. That's what I can tell you.
All right, doctor.
Yes, please. Yes, Ripon. I'm sorry if I'm pronouncing your name wrong. You can go ahead,
Yeah,
please.
you're okay. And thank you, sir, for your nice clarification. I have a question. Those who will appear January date, will they can appear in April date?
As I have already shown you that they have
Yeah.
arranged these diet in such a way that the application window for the next exam, for the next diet, is open when the results are not yet out. Okay, so you don't know exactly that if you will gonna pass or if you will gonna fail. So if you will gonna, for example, I have already shown you that if you are appearing in January diet, you will not be able to appear in the April diet because the window for the application will be from 5th February to 15th February, while the results are on 23rd February. So you will have to miss that diet if, God forbid, you fail the exam. God forbid. So that's why it's really important to go into the exam fully prepared, to get to know what they will gonna ask you there. And that's how this exam you will gonna pass it in first attempt. And you will not even, when you will be coming out of the exam, you will be so confident that I have already aced this exam, man, because I know what they wanted to ask me. There were these distractors in the STEM, and that's how it will gonna work. I hope that makes sense.
Yeah, thank you, sir.
Yeah. So, Dr. Sarmad Azhar.
Hello, thank you so much, Dr. Josefa, for the whole explanation. It was very helpful. Thank you again.
Most
And
welcome.
I wanted to ask that, I have IMC registration right now, but I still am interested in giving the MRCP 1 exam. So I wanted to ask that, will we be able to save this information, like for making the ID and everything? And one more thing, that I have an epic verification of my degree already. So will that work?
Okay.
Thank you.
So the answer to your first question is that Royal College of Physicians is a separate entity, and the Royal College of Physicians Ireland is a separate entity. Okay, so they are not interrelated. But if you have completed your if you have completed your MRCP Part 1 and Part 2 written, okay, I have heard most of my colleagues, they will go without completing MRCP. Like you can judge the value of MRCP UK by this, is that with only MRCP 1 and 2 written, you can get the training job in Ireland. And most of my colleagues are in training just on the basis of their MRCP UK 1 and MRCP UK 2. They haven't completed their paces. Okay, that was the answer to your first question. The second thing is that the epic verification, it is not required in MRCP. It's only required when you will gonna get yourself registered with the GMC. Okay, so
All right.
so that's how it works. I hope that I have answered your question.
Okay. As you mentioned in while making an ID, we require a notary verification attestation.
Yes.
Yes. So I was just a bit concerned that are these the same thing or that's something different?
It's the same. Like, of course it's the same. Like, you can get it, not notary, you know what notary is. It's like you can get it from any judicial commission, any judge. Or you, if you don't know what, not, don't get confused. Get it
All
get
right.
it attested from your principal, get it attested from your university, get it attested from any of the royal. The best thing is the person you can approach is go to any of your like in your hospitals, in your medical colleges. There are always doctors, physicians who are MRCP or who are FRCP, right? So you can
Yeah.
get you can get yourself attested, you'll get your degrees attested by them. So that's the simplest way.
Okay. All right. Thank you so much.
Welcome. So Dr. Vishnu.
Hi, Dr. Zaifa.
Hello.
Yes, can you hear me?
Yeah, loud and clear.
Yeah, so I just wanted to ask you about the primary medical qualification. Uh, regarding that, I've actually done my MBBS and my master's degree. So should I attest both of them from a recognized entity, or do I have to get it from the universities where I've completed both of them?
No. You just have to get your degree for MBBS attested. That's it.
Just MBBS, yeah?
Yes, just MBBS.
Oh, okay. Thank you.
Your master's is an extra degree. That is a like postgraduate degree that's a separate thing. That will gonna
Yeah.
help you later. It's not like it's not like helpful here in MRCP, and you don't have to send them that. The only requirement is your MBBS degree.
And that I can get attested from any recognized entity, correct?
Yes, I have already explained that.
Okay, yeah. Thank you.
Okay, so guys, can you please, yes, anyone else having the question?
Excuse me, sir.
Yes, please, Dr. Masoodur Rahman.
Yeah, sorry, I don't know where is rising hand, so I talk directly.
No problem.
Sir, I have
Go ahead.
First of all, I'm thankful for your cooperation. Thank you. And my question is, sir, the start of the meeting, you showed the pathway, like how you gonna go progress,
Yes.
get progress there, like FY2 in certain things. And what was the other pathway, like for the IMGs? Is I recently cleared my PLAB 2 and got my GMC registration. So I'm interested in like if I do my MRCPs. So if you, my question is, if you repeat those pathways, like what is the pathway for the IMGs? Where will we stand after passing MRCP?
Okay, no problem. So the thing is that, first of all, you are already done with your PLAB exam, so you can apply for the GMC registration. Okay, so if someone has if someone does not have GMC registration, they can also get registered through MRCP pathway. Okay, so if you will gonna do MRCP 1 or MRCP 2, as you are already GMC registered, so you will gonna get a job, and you can go and get yourself appointed as a junior doctor, as a clinical fellow there in UK, and you will gonna get your paces done there if you want, because that's possible for you, and it is a recommended thing to do your paces, or you to complete your paces there in UK, because you will get to know the working environment, what are the guidelines, how they work, and everything. That's a separate topic, that's a separate debate. So if you are going through MRCP pathway, and you are going to get yourself GMC registered through MRCP pathway, you will be recruited as a registrar. It's a post which is actually above the junior fellow. Okay, a registrar, like we have registrar here in our countries, in Pakistan, in India, everywhere, in UAE, right? So these registrar, what they will do is that once they are inducted in the NHS, they will gonna fill a form which is a competency form. That competency form has certain criterias. Like, it's a form in which they will gonna assess that are you competent for this thing, are you competent for this thing. There are certain check the boxes that you have to check. Okay, and it should be checked by your supervisor. If you have already completed your training in Pakistan or in India, postgraduate training, then you can get that form signed by your supervisor. And you, because there is a criteria, there are certain things that you have to go through before getting those form checked. That's a big and lengthy debate, which we can arrange seminar sometime else. But it's just a simple overview that if you have passed MRCP, you will gonna get recruited you will get your GMC registration, and you will gonna get recruited as a registrar. To get into the specialty training, you have to complete that competency form. Okay, that makes sense?
Okay, sir. Thank you.
Okay, so perfect. So Dr. Salma.
Hello.
Hello.
I want to ask if one hasn't done anything like PAB or something, and is planning to take this MRCP 1, then we can apply for MRCP 2 if that person is not doing any training in Pakistan or anything, maybe a simple job, private job. He can take MRCP 2, or is there any training or something?
That's a very good question. Most of the candidates, they have this confusion that it is absolutely compulsory for you to be in a training to do the MRCP. No, that's not true. You just have to have 12 months of experience post house job. That's it. After that, you are eligible to appear in MRCP 1, 2, and PACES. If you have done 1, you can appear in 2. If you have done 2, you can appear in the part 3, which is the PACES. So you are not required to be in a training program anywhere in the world to take MRCP.
Thank you.
Assalamualaikum, sir.
Yes, walaikum salam.
Is both are theory papers, part 1 and part 2? MRCP?
Yes, part 1 and part 2 are the written exam. They are pen or paper, and you have to fill the bubbles. And you can also take it online. At the same time, if you don't want to take it online, you have to go to a center to fill to sit in the exam. And the third part is a clinical exam, which is actually the same as more or less similar, like you do your final year OSCE.
Sir, both 3 are conducted in Pakistan.
Both 3 are being conducted in Pakistan, India, Bangladesh, United Arab Emirates.
Right. Thank you, sir.
Welcome. Yes, please, Dr. Safa.
Hello, good evening, sir.
Good
I have a
evening.
doubt. If I pass MRCP part 1, exactly what is the cutoff for passing the PACES? That is, for steps we have 7 years. Is there any cutoff for MRCP?
Yes, that's a good question. So what exactly the cutoff is? 7 years. If you have done your MRCP now, then within the next 7 years, you have to complete your whole MRCP, including PACES. If you will not gonna be able to, then you have to resit for MRCP 1.
Okay, sir. And once we complete the paces, the degree will be ours. No, we don't want to do any extra exams, or we don't have to go to UK, anything like that.
No, that's totally up to you. Like most of the physicians, that's what the beauty of MRCP is. The thing is that it's like a degree. Like if you will get it, you will be you will be a specialist. You will be a consultant. You will be a physician. You can work as a specialist in Pakistan, in United Arab Emirates, in India, right? If you don't want to go to UK, if you don't want to pursue the further training there, that's totally up to you. Once you will get the degree, you are eligible to work as a specialist.
Okay, sir. Thank you. Thank you, sir.
Yes, please. I'm really sorry. I will not be able to pronounce your name right, Dr. Devi. Dr. Chakraborty, yeah, please. Yes, Dr. Chakraborty, can you please ask your question? Okay, guys. So we have to move on to our next part because it's already too late, and I will gonna be going really fast through that so that we will be able to finish our presentation. Okay. Okay. So next is MRCP part 2. So if once you are completed with your MRCP part 1, only then you are eligible to sit in MRCP part 2. Okay, just make it clear. You cannot skip part 1 and appear in part 2. That's not how it works. Okay, so in part 2, how it is different from part 1? That's very important to understand. Part 2 is different because it will test your ability to apply clinical understanding, make clinical judgments, and take responsibility for prioritizing diagnostic or problem list, planning investigation, selecting a plan for immediate management, selecting a plan for long-term management, and assessing the prognosis. So what is this telling us all about? This is telling that it is more of a clinical exam. You will be getting more of clinical questions. The stem will be very, very long, lengthy stem, and then you will be having 5 options and you have to complete the question. Okay, so in this they may ask you about what is the best initial management, what is the best gold standard management, what is the best initial test you have to request, what will be the next step you will be doing, what is the prognosis for this, what is the long-term management. So that's how MRCP2 is. Okay, so let's go through the format. Same format as of MRCP part 1, with only one difference. The exam will be having images. It can be clinical photographs for dermatology, for rheumatology. There can be clinical signs. There can be clinical pictures of different lesions. There can be clinical pictures of the hands. There can be clinical picture of the leg, any rash, anything like that. Okay. Okay, guys, if any one of you is not able to ask the question, don't worry. After this part, we will be having a small question and answer session again. So please just wait for it, and we will be answering those questions. And just write it down for me, please. Okay. So let's just move on further. So it can be clinical photographs. It can be pathology slides. They can show you the slides for the pathology, which we have studied maybe in MBBS first year, second year, histology. Then there can be inheritance tree. Like they will give you like this. Like for example, this is XX, this is XY. There is certain disease. Then these are the offsprings, like this, like X, Y, whatever. I'm just giving you example to make you people understand. They will leave this box empty, okay, and then they will do, there will be a big hierarchy like this, a tree, okay, and then they will be gonna asking you, please tell us, is it autosomal dominant, it is autosomal recessive, it is X-linked recessive, X-linked dominant, what exactly it is, okay. So that's what an inheritance tree stands for. There will be ECGs, very, very important. There will be at least 4 to 5 ECGs in part 2, guys. And most of the candidates, they really struggle with the ECGs. We really struggle with the ECG because they haven't seen it, they don't know how to catch it, they don't know what they will gonna get in the ECG. So that's where the coaching comes in. That's where, like, because you have to cover a lot of things. You have less number of months to cover it. At the same time, most of us, they are working. Like, it's not like that everyone is sitting home and preparing for the exam. So that's what important. That's where we guys are here to help you. Because if you will gonna start studying ECG, let me tell you guys, like, you will need at least 3 to 6 months to understand ECG and to pick up what exactly it is in the ECG. So it's really difficult, okay, because you have already completed your 5 year of MBBS, you have completed your house job 1 year complete. And those students who haven't worked in cardiology, I am 110% sure that no one of the students who haven't done cardiology don't know how to read the ECG, because it's a subject which will only which you will only understand once you are seeing it and once someone is guiding you that what you exactly have to see in it. Guys, please mute yourself. Please mute yourself. It's a request. Please mute yourself. Okay, so there will be X-rays. X-rays can be chest X-rays, joint X-rays. X-rays can be skull X-ray, any X-ray, sinuses, any X-ray. Then there will be CT scan, MRIs. Then there will be echocardiogram. Yes, echocardiogram, ultrasound of heart. And there will be ultrasonography, maybe abdominal, maybe pelvic, maybe some. So it will include all of this, the MRCP part 2. Okay. So first, let us see that it also contains 200 MCQs. Same, everything is same. Everything is same like part 1. Okay. But you can see that here there will be no clinical questions, clinical sciences, sorry, not clinical questions, clinical sciences, because now they will gonna assess your knowledge more on clinical subjects, prognosis, management, and all of those things. Okay. Same cardiology, but the number of questions has increased. Pharmacology, number of questions has increased. Dermatology, number of questions has increased. This endocrinology, more questions. Hepatology, 19 questions. Geriatric medicine, more questions. Hepatology, 9. Sorry, hematology, infectious diseases, medical. So you can go through all of that. Okay. So this is how. So this is where you will gonna focus now. Passing rate is 60 to 80%. Like, passing rate is more. Why? Because students have already passed part 1 and now they are appearing in part 2, because the knowledge from part 1 is really important to get through part 2. Okay, if you have studied well for part 1, only then you will gonna able to pass part 2. Okay, so that's very important, because that's the knowledge we will gonna carry forward for the part 2. The only addition will be that there will be more clinical questions, but the basic knowledge concepts will be the same. You will have to work more on the images, you will have to work on the other extra things, but the knowledge that you have already gained from part 1, that will be the same. Okay, so that's why it is really important to prepare well for part 1. That's your basics. That will be the building stone for you guys to move forward in MRCP. So now we will be having a question answer session. So if anyone was left to ask any question, So please, you can go ahead and you can ask question, and we will be moving forward in our presentation. Yes, please, Dr. Numan.
Hi, Dr. Zafar.
Yes, yes, hey.
Yes, yes, sir. Yes, yes, sir. Sir, I want to. Sir, I want to. Sir, I want to ask how much years it usually takes to secure a seat for PACES after completing passing MRCP Part 2.
Sorry, I cannot hear you. Your voice is breaking. It is echoing. I think you are on speaker or something. So please.
Now, am I clear?
Yes, you are clear.
Yes, I want to ask how much years usually it takes in Pakistan to secure a seat for PACES after clearing MRCP Part 2.
Okay, so I think no one can answer you that question. That totally depends on your luck, and you just have to keep on applying. And the thing is that I have seen candidates who have secured their thesis date like maybe after 6 months. Okay, and I have also seen candidates who are still waiting for their MRCP dates after 2-3 years. So that answer, no one can answer it. But the assurance that I can give you is that they have increased the number of diets, and at the same time they have increased the number of centers all over the world. So they are accommodating more candidates now, and with the passage of time, the backlog which was created in the COVID times, it will gonna be I think fixed, and everyone will, like, everything will be very smooth. Okay. Yes, Dr. Chakrabarti, can you please unmute yourself? Because from my side, I have already I have already unmuted you, so it's from your side. Dr. Numan, you still want to ask any question?
Hello, sir.
Dr. Chakrabarti, if you are not able to unmute yourself, you can please type your letter, type your query in the chat box, and I'm gonna answer it. Okay?
Hello, sir.
Yes, Dr. Aswan.
Yes, sir. Sir, I would like to ask, are you done with the presentation on MRCP Part 1 completely, or you would describe its resources, study resources later?
No, I'm not done. We will be going to that part later in that presentation. Don't worry about that.
Okay, sir. Okay. Thank you so much. That's what I wanted to add.
Okay. Any other question, please, or we will be heading forward to our presentation. Anyone wants to ask any question? Okay, so we will be moving further to our presentation, okay? So guys, now is the part for the study resources, and the study resources, there are a lot of study resources. There are notes, there are textbooks, there are question banks, past papers, and there are crash courses as well. So first of all, let me go through each and every notes. There are a lot of notes, notes by Al-Maghribi, Clara, a lot of notes are out there, okay? Then there are textbooks. Textbooks are only for the reference. If you want to get reference, only then you should open the textbook, because you cannot go through each and every topic, because there's a lot of information out there. So you guys cannot you guys cannot complete textbook, because I have already told you that MRCP is all about revision. It's revision, revision, revision. If you will not gonna revise, you will not able to recall all what you have learned in the exam. When you will be sitting in the examination hall, you will be stressing out that I should have revised that. That's how the exam is. That's how this exam is going to make you feel. Okay, so the next study materials are the question banks. There are different question banks. There is past medicine, past test, BMJ. Okay, so for the part one, I would really recommend you guys to stick to one question bank, and that is past medicine. Past medicine is the Bible for part one. Okay, and then there are past papers. And past papers, you can get past papers offline, you can get past paper in online, like with the subscription of past test. So it's very important to do the past papers as well. Then there come the crash courses. So what is the importance of attending courses? Let me tell you that the courses are designed in such a way that these are very much time efficient and effective, because we all are working, you guys all are working with your jobs. And with jobs, it's very difficult to have time for studying and to take time out. And at the same time, it's really hard to concentrate well with a hectic job. But these crash courses, they help you guys, they really help you to focus on the particular thing, to focus on key points that will gonna come in the exam. Okay, because the mentor will gonna tell you about that in this topic. You just have to remember this thing. You don't have to read whole of the 3 pages. You just have to remember these 6 points, and any question from this topic will gonna be from these key points. Just look for these key points, just look for the concept. They will gonna give you the major concept, that what exactly this topic is about. That's it. And I'm gonna demonstrate that further when I'm going further with my presentation on dementia. Okay, so that's why it is very important to have someone to coach you, to have someone, because I have told you that these exams are getting very expensive. The time is very expensive nowadays. Everyone is competing for the jobs, for the posts and everything. So it's very important to pass these exams in first attempt. So that's very important. Okay, so uh, what I want to suggest you guys is that question banks are really important. Question banks should not be like, you should not start with the textbook or notes or something. Question banks are very important, and past medicine is the best, because in past test and other, there are a lot of maybe 5,000 questions. So past test is not recommended for part one, because it has a lot number of questions and you are not able to finish it. And I have already told you that MRCP is all about revision. So past medicine will gonna build up your basic knowledge. At the same time, it is also lengthy. So that's why you need someone who can guide you. That because once you are done with reading all of the question bank, let me tell you guys that you will gonna not retain even a single thing. You will say that what I have learned, I don't know. It's a very, medicine is a very volatile subject. Medicine, especially the topics like pharmacology, the mechanism of actions, the drug names, and the presenting complaint of the patient. These are very volatile things, and you will not be able to recall them in the end. So if you are guided in a proper way, if you are told that you should take this path, and it will gonna lead you to the finish point, how it seems. Or if you are just left unattended and you will just gonna go here, you will gonna there, and you will, please mute yourself, guys, please mute yourself. So that's why you like, everyone needs coaching, and there is very clear and cut picture I have portrayed for you guys. Okay, so some very few common questions that are required that are being asked everywhere regarding MRCP exam. So time required for the preparation, it totally depends upon person to person. If you are doing job, it will be different. If you are not doing job and you are just sitting home and you are just studying, that, and every person know his or her capabilities and his mental like how they are able to retain, how fast learner they are, or they have to go through again and again. So everyone has a different learning curve. Okay, so those candidates who already know that they are very good at learning everything and like they can retain everything, not everyone is like that. Okay, most of us, they require guidance. Most of us wants that we should be told that what, because it's a lot of syllabus and you will not be able to finish each and everything on time, and you also have to do revision. And once you will gonna open the textbook, or once you will gonna open the question, you will gonna see that every topic has a lot of information, and you will be just lost that what I have to remember, what I can leave, what I cannot leave. So that's where we're gonna help you with that. Okay, at the same time, I have already answered this question, that is the training program essential or not. So training program is not essential. If you're not in training, you can still sit for the exam. Passing marks, total marks, scoring criteria, I have already told you guys. Okay, and then is a difficulty level, and I have already explained the difficulty level to you. At the same time, this is the chart I have taken from Royal College of Physician website, and you can see that exams set are very high standard and many people do not pass in their first attempt. You can go to the MRCP website and you can see that I have taken this chart from there, and you can see part 1 is in blue, and part 1 has the lowest passing marks rate. That's why part 1 is really important to pass, because it's a difficult exam. Part 2 has the most uh, most of the candidates can pass part 2 easily because they have already passed 1 and they have good knowledge. So part 1 is very important to study well, to go through it well, because you can see here, it's not what I'm telling you, it's what MRCP or RCP, Royal College of Physician, is telling you, that people cannot pass the first attempt because it's very important. They don't know how to study, they don't know that what they have to retain, how the exam will come, how the questions will be there. Okay, so that's how it's important. So this is, I have also taken it from the site, and you can see, you just focus here because these are for the UK candidates, so you should not focus. You other candidates, you can see attempt, in first attempt only 54.9% candidates has passed, and this is the report from 2022. Okay, and let me remind you that in this 54.9%, there are also candidates who might have been appearing for the second time or third time or fourth time. You can see it is written here. If you want to read this report, you can go to the website and you can read. Okay, so if you can read it, let me tell you that wait. Yeah, see, if a candidate failed at the first attempt but passed on the second, they would be in the fail column for the first attempt and pass column in the second and sixth attempt. So this is the passing, like 94%, very low, very low. And you can see that moving on further to second to sixth and seventh attempt, percentage is falling more. Why? Because people will gonna give up. They will not take the exam because they will not be able to understand how this exam is working. So I have already told you that this exam is not an easy thing. Okay, so how to pass it in the first attempt? I have already emphasized much on this, and I have told you that it's very important to have the basic understanding of the exam, to manage how you will gonna to manage your time, how you will gonna manage your time. At the same time, um, time management in the exam is very, very, very important. Okay, that's what the mentor will tell you, that how you will gonna manage time, how you will gonna plan your study. Okay, and reading the question, long stems, the question will be long. Okay, so you also have to look for the time. So it's very important to manage time as well, and how you have to read the questions. There are special techniques that how you can read the question. Like for example, it's better to read the last line first, okay, so that you have an idea what exactly the examiner is asking me. Then read the stem again, like last line of the stem, then go for the whole stem. Then you will be having a better understanding, and you will focus on the thing that has been asked from you. At the same time, revision and revision, very, very, very important. Put yourself under the pressure of time and do mock exams. At the same time, don't try to memorize things, try to get the concept, try to get the key points which are being asked and which will be asked, because MRCP is all about concepts. If you will think that I'm going to memorize everything, I'm going to tell you 100% that in the exam you will gonna get so much confused that I have read this as well, I have read this option as well in the topic, but why it is like there, as I have already described, that they will be very, very closely related to each other. But if you know how to approach the topic, if you know that what are the key points I have to look for, what is the distractor in this one, so that's how you will gonna attempt the question right. Okay. And please don't try to skip any speciality in the curriculum. Everything is equally important, and everything will gonna contribute, like, to get you passed in MRCP exam, especially in MRCP 1. Okay, so it's very, very, very important. So guys, moving further, we will gonna topic. So this is the presentation I have prepared for you guys, and this is to tell you that after this presentation, I will request you guys to go to your textbook or go to your notes, whatever you want to study, and just go and look for the topic of dementia, and you will come to know that it is a very, very big topic, and it will take maybe whole of your day to understand dementia. But in this presentation, I'm gonna show you how I'm gonna make it so easy for you guys that whatever the question is, it will gonna come in the MRCP part 1. You will gonna immediately pick up that what exactly they want to ask you. But if you will gonna read it yourself and you will gonna try to solve the question, you will not be able to understand that because these, and this is only one example. Like there are hundreds of hundreds of topics. Like they will go, like for example, we're gonna move further, and then I will gonna be able to explain it to you better. So, what is dementia? Dementia is an umbrella term. Actually, it can be related to any of the disease. It can be related to Alzheimer's. It can be related to vascular dementia, Lewy body dementia, frontotemporal dementia, and other dementias, which can be Parkinson's, Huntington's. It can be with the alcohol-induced. It can be Jacob disease. It can be degeneration, supranuclear palsy. So guys, let me tell you that these all are the names that are mentioned here. They all are included in your curriculum, and these you can get questions from any of these topics. I have told you that MRCP is a very, very vast subject. Whole of the medicine, you can get questions from, and you will get questions. Like you can get questions from Alzheimer, from vascular dementia, from Lewy body, from frontotemporal, from Parkinson's, from Huntington's, from alcohol-induced, from Jacob disease, from cortical degeneration, from progressive supranuclear palsy. So this is only one example I'm giving you, just to make you understand that how it is important to have a proper guidance to make your study very effective and very time efficient, and to pass it in first attempt. Okay, so for example, dementia, all of these diseases present with dementia, but there are only few things that differentiate one from the other. And here I'm gonna talk about those things, and I'm gonna talk about these major dementias. Please mute yourself, guys. Please. Okay, so moving further, let's just first know about Alzheimer's. I'm gonna tell you the basic points of that of these diseases, and then we will gonna solve questions, and you guys gonna answer those questions very efficiently, because I have the way I am gonna teach you now is that will gonna help you understand those questions immediately. Okay, so once you will open the textbook and everything, you will gonna know that there are long lengthy paper, like everything will be written there, but you don't know what you have to remember. But here I'm gonna tell you that in dementia, these are the things that you will gonna only remember, and these are the things that will gonna come in the exam. And the questions that I have picked for you guys are from the past papers, okay, from MRCP. So it will gonna help you guys. Anyways, so let's start with the Alzheimer's disease. So what is Alzheimer? Alzheimer is a progressive degenerative disease, okay, which affect the temporal lobe as well as the parietal lobe. Okay, so please study it with the concept. Don't memorize it. Once you will study the concept, you will be able to remember things. Okay, so you should know that if the temporal lobe is being degenerative, it will result in the memory loss. And what will be the memory loss? Patient will not be able to remember where he or she has placed the keys, leave the stove on, and there will be language deficits. Patient will be having difficulty in remembering or finding the words. So word finding difficulty is a part of Alzheimer's disease. Okay, and when the parietal lobe will be degenerated, there will be the problem with the spatial navigation. Like if you will gonna leave the patient out, they will gonna get lost during the walk outside. So remember, parietal lobe, temporal lobe, and what are the findings? There will be word finding difficulties. Patient can get lost. Okay, so further, when you will go on to the pathology, in pathology, what you have to remember is that what are the deposits which are usually in Alzheimer's disease. So you just only have to remember that there are amyloid plaques. There is a big paragraph about the pathogenesis, but what only you have to memorize is that what are the plaques, what are the deposits in Alzheimer's disease. It's only the amyloid plaque. Okay, so the second type of abnormal aggregation will be tau proteins. So amyloid proteins or amyloid plaques or tau protein. These are the only two things that you have to memorize in the pathogenesis. We are done with that. Okay, then moving further, what we are doing right now is that what you have to do is that I told you that you have to be very conceptual here, and you have to be very you have to study with the concept. You don't have to memorize things, because that's how it will gonna help you memorize things. So in Alzheimer's disease, what is the pathogenesis is that there is a reduced production of choline acetyl transferase. There is a reduced production of choline acetyl transferase. So what will happen if there is reduced production of choline acetyl transferase? So what will happen is that there will be decrease in acetylcholine synthesis and impaired cortical cholinergic function. So it means that if cholinesterase is low, what will happen is that acetylcholine synthesis will be decreased. Acetylcholine synthesis will be decreased. So why I'm emphasizing it more here is because, if you know the pathogenesis, you will remember the drugs for the management. Okay, because once you are done with whole of the MRCP, you will not be memorizing, oh, what was the drug for Alzheimer? Oh, I cannot remember. What was the drug for this? What was it? So if you know the pathogenesis, if you know the concept, you will immediately remember that, okay, what happened in Alzheimer is that acetylcholine is less. So if acetylcholine is less, so there will be some drugs which will help to increase the level of acetylcholine, which will help in Alzheimer's. I hope that makes sense. Then the second part of the pathogenesis is that there is excessive activation of NMDA. NMDA receptors play a role in Alzheimer's disease. There is a very long paragraph about NMDA receptors. You don't have to remember that. You just have to remember there are 2 points in the pathogenesis. One is that acetylcholine is being produced less, and the second is that there is excessive activation of NMDA. NMDA is a type of receptor which is causing the Alzheimer's disease. So what can be the management for it? It means that excessive activation, so we have to decrease the activation. We have to downgrade the activation of the NMDA. So it can also help in the management of the Alzheimer's. So 2 pathogenesis and 2 treatment options, which are, we will read later. So now, how you will gonna recognize this in the scenario that it is Alzheimer? That will be from the clinical features. Okay. In the clinical features, what you will gonna see is that there will be impairment in learning and recall of recently learned information. Very important word, recently. Short-term memory loss. Short-term memory. If you will gonna tell a patient something, and after 5-10 minutes you will gonna ask that what you have told, the patient will not able to recall it. That's what Alzheimer's is. Recently learned information. Remember this thing. What is the second point? The second point is that a deficit from other domain, that is visuospatial domain, that I have already told you. Patient will be lost. Patient will be lost if they will not be able to remember the pathway. They will not be recognized. They will not be able to recognize a family member. Okay. Unable to learn, unable to recall a major family event. So the major thing is short-term memory loss. Okay. And recently learned information, they will not be able to understand it. Okay. So in the management, just now recall the pathogenesis. Acetylcholine was being produced less. So what we will gonna do? We will gonna increase the amount of acetylcholine by giving acetylcholine esterase inhibitors. Acetylcholine esterase is an enzyme which break down acetylcholine. So when we will gonna give acetylcholine inhibitors, it will gonna increase the amount of acetylcholine in the pre and postsynaptic membranes, and it will gonna help in the treatment of Alzheimer's. That's how you read for MRCP. That's how you learn the concepts for MRCP, and that's how it is so easy for you. You just have to remember the pathogenesis, like what happened. Acetylcholine is less, so we have to increase the amount of acetylcholine to make the patient feel better. So that's where you will gonna give acetylcholine esterase inhibitors, so that they will help in increasing the amount of acetylcholine, and because of that the patient will feel better. That's not where it ends. So you have to remember there are 3 major drugs being used: donepezil, clentamine, rivastigmine, because these are the things that you have to cram. These are the things that you have to cram. So I have nothing much to tell you about that. So, and what you have to remember that is very important is that acetylcholine esterase inhibitors are used in only mild to moderate Alzheimer's. When you will be reading whole of the management, you will just ignore this thing, that mild to moderate is only for acetylcholine esterase inhibitor. But I am the one telling you that this is an important point. You have the MCQs will gonna come for mild or for moderate and for severe. The options will be different. The answer will be different. You will say that acetylcholine are being used for the Alzheimer treatment, so let's take acetylcholine esterase inhibitor, donepezil. But no, the answer will not be that, because in the STEM it will be mentioned that it is a severe Alzheimer. So for severe Alzheimer, the treatment is different. So that's how it goes. Okay. So as you can read it here, no role for acetylcholine in advanced Alzheimer. Advanced means severe. Okay. So moving further, what is actually severe? What is actually severe Alzheimer's? So if there is a questionnaire designed by the NHS in which there are certain questions: 1, 2, 3, 4, 5, 6, 7, 8. These questions you will gonna ask from the patient, and it is called as mini mental state examination, MES. Okay, so you will gonna score it, and the score is from 30, 0 to 30. Okay, so if the score is less than 12, it is severe dementia, it is severe Alzheimer's. Okay, so they will gonna mention that the MMSE score is this, MMSE score is 8, MMSE score is 10, MMSE score is 11. They will not tell you that it is severe dementia. They will just tell you that the MMSE score is this. So because of that, it is now severe. So now we cannot give acetylcholine esterase inhibitors. Okay, so now the treatment will gonna change. Recommend NICE guideline recommend discontinuation of acetylcholine inhibitor once the mini-mental state has fallen below 12. Okay, so now what is the option for us? What we have here, we have is that we have to withdraw the donepezil and possibly consider memantine. Guys, memantine is this NMDA receptor antagonist. In the pathogenesis, if you will gonna go back, there was excessive activation of NMDA. So we have to reduce the activation. So if you guys, so if you guys gonna look here, antagonist. In the pathogenesis, receptors were being overactivated, but now we are giving the antagonist, the receptor less activated. So that's how the pathogenesis and the pharmacological treatment go in hands. Okay, that's how you have to remember and correlate things. That's how we're gonna help you tell that. So, guys, please go on mute. Check your mic, please. Check your mic, please. Doctor, please go on mute.
Dementia. Huh? Okay. There's some like
Can you please go on mute?
when they should do the day, it's when I want to go around the side. Okay, no adrenaline.
So please, it's how hard it is to get muted. It's very easy, guys. Just please mute, because the tempo, like you guys are just breaking the tempo, okay? And it will gonna affect you correlating things. So please just check yourself, double check, go on mute. Anyways, so once the MMSE score is less, you will give memantine. You will not give the acetylcholine esterase inhibitor. Okay, this is how the exam the question will come. I have told you. The second question which can come in the exam is that there are, because I have told you that in MRCP 1 they will gonna check your basic knowledge as well. So they will gonna ask you the side effects, the mechanism of actions, and some few basic questions. So it is very important. How the exam question will come is that a patient who is being diagnosed with Alzheimer, okay, and recently being diagnosed with Alzheimer, and you did an ECG, okay, you did an ECG, and there is a bradycardia, okay, which they will ask you in the exam question that which of the following drugs you will gonna start for this patient, and in those drugs there will be an option for only one acetylcholine esterase inhibitor, which will be donepezil. The rest option second will be memantine. Then the third, fourth, and fifth will be something else. Okay, so you will say that the patient is not having any severe. The patient is not having severe dementia, so it means that this is donepezil. No, but the answer will be wrong, because there is a side effect for donepezil. It caused bradycardia. The patient ECG was done, and it is already showing the patient is in bradycardia. So the answer will be memantine. It will not be donepezil. That's how the question comes in MRCP. And I just want to give you a reality check that just imagine when you have whole of the course for medicine, will you be able to remember that donepezil caused bradycardia? There are maybe thousands of other drugs you have to remember if you will gonna read it on your own. But if I have emphasized it and I have told you that how it will gonna come in the exam, so you can see that you will never ever forget now that if it is bradycardia and if it is Donepezil, you will not select it. You will only select memantine. I hope that makes sense. Similarly, the case with the rivastigmine. Rivastigmine can cause AV block. If the patient ECG is in block, ECG shows that there is block, you will not gonna give rivastigmine. This is the side effect of it. You will gonna give the patient memantine. Okay. So, and methyl acetyl antagonists that I have already shown you. These are so. These receptor antagonists I have already told you, it is only given when there is severe Alzheimer or the patient is intolerating the acetylcholine esterase inhibitors. Intolerating mean what? I have told you, if there is bradycardia, if there is AV block, or if there is urinary retention. Okay, so these are, then we will use the NMDA receptor antagonist. Okay. So the next type of dementia is Lewy body dementia. Okay. In Alzheimer's, I have told you what is in the what is accumulated in the in the what there are tau bodies, and you can, if you can recall it, there are two things, amyloid plaque and tau bodies. Okay. If you will go forward and if you will gonna look at Lewy body, there will be alpha synuclein. This is the cytoplasmic inclusions which are called Lewy body. That's why it is called as Lewy body dementia. It is a second type of dementia. Okay, these, I told you, dementia is a broad term and there are different type of dementia in it. So that's how the first one was Alzheimer, the second one is Lewy body dementia. Okay, so this will be the plaques, or this will be the deposit, alpha synuclein. That's what only you have to remember. Okay, the next is that how the patient will gonna present. Alzheimer, sorry, it is dementia, so there will be progressive cognitive impairment. Progressive means slowly patient will get worse. Second thing, there will be Parkinsonism. Wow, there will be symptoms of Parkinsonism: bradykinesia, tremors, shuffling gait. Okay, so these are the symptoms of Parkinsonism. Then very important, visual hallucination. So whenever there will be a question about Lewy body dementia, the patient will be having dementia, patient will be having symptoms of Parkinsonism, patient will be having visual hallucination. Wherever you see visual hallucination, these are the signs and symptoms of Lewy body dementia. That's how you remember it. That's how it's gonna come in exam. Visual hallucination always associated with Lewy body dementia if you find other feature. So guys, this might seem very easy for you right now, that I can also understand, or you can also understand, that only it is written visual hallucination, so I'm gonna remember this thing. But the way the question will gonna come in the exam, they are so confusing that there are so many distractors. And when you will be reading whole of the neurology, you will see that there are multiple diseases which presents with dementia, features of dementia. So there are very few demarcating things that will gonna differentiate them. So you can see that Parkinson, if patient is presenting with Parkinsonism, if it is a Parkinson's disease, patient also have dementia in Parkinson's disease. Okay, so if you will gonna read them all together by yourself, it will be very hard for you to differentiate that, how it will be differentiated. And when it will come in the exam and you have not done a good revision, you will not gonna recall everything. Okay, so you can see it is written here. It should be distinguished from the Parkinson's disease with dementia, that I have already told you that Parkinson's disease can also present with the dementia, Parkinson disease with dementia. Lewy body is also presenting with Parkinsonism, so it is very confusing. But how you will be differentiating is that the Lewy body dementia is diagnosed when the symptoms begun at the same time or within a year of Parkinsonism. Like if a patient has presented to you with symptoms of Parkinsonism and dementia, it means it gives more chances that it is Lewy body dementia. But if the patient has Parkinson's maybe for 5 years and now the patient has started developing dementia, it means that it is Parkinson's disease with dementia. That's how it is differentiated. Okay? And how you will gonna diagnose the Lewy body dementia? Clinically, as I have already told you, at the same time, SPECT scan. SPECT scan is 90% sensitive, 100% specific. Very important. SPECT scan. So what is the treatment for Lewy body dementia? The treatment for Lewy body dementia is rivastigmine. We have already told that rivastigmine is the acetylcholinesterase inhibitor. Okay, so as it is dementia, so it is used as a treatment for the Lewy body dementia. Now, very, very important point. Very important point. You will gonna get in the exam 110%. 100. This question will always be there. What is the question? The question is that, first of all, let me tell you that in Lewy body dementia, antipsychotic drugs, which are also known as neuroleptic drugs, they are contraindicated. Don't just memorize it. Learn the concept behind it so that you should know what exactly is the concept. So if I'm going to ask you guys, what is the mechanism of action of antipsychotic drugs? Antipsychotic drug decrease the dopaminergic neurons, decrease the dopamine release in the presynaptic terminals. And we have already seen that this Parkinsonism, what is the mechanism of action behind Parkinsonism? In Parkinsonism, there is already decreased dopamine. Because of decreased dopamine, patient is having Parkinsonism. And we give drugs like levodopa to increase the level of dopamine. So, and antipsychotic drugs, their mechanism of action is they are decreasing the level of dopamine. So in a Parkinson patient, there is already low dopamine. So when you will gonna give antipsychotic, it will gonna make the Parkinson worse. So that's why in this condition, in Lewy body dementia, patient always, I told you, has Parkinson as well. So when you will gonna give antipsychotic drugs, it will gonna develop irreversible Parkinsonism. Very important. Very, very important. How this question, haloperidol is the antipsychotic, contraindicated. Okay. Then the question, how the question will gonna come? The question will gonna come is there will be a history of patient who get deteriorated following the introduction of antipsychotic agent. Always think of Lewy body dementia. Okay. What will be the mechanism? They can ask you in two ways. What is the condition? And what they will not tell you the condition, and they will ask you how you will manage it. So the condition will be Lewy body, and how you will manage it. The first step is stop antipsychotic drugs. That will be in the option, and that will be the first and correct answer that you will select. Okay. So the next topic is frontotemporal dementia. This is one of the major terms and major things in dementia. Okay. So guys, I have only selected few dementias from the topic, which are really important. The other are also important, and they are also frequently coming, but I'm not able to complete all of them. This is just an overview and just a sample to tell you that how a guided study and how it will gonna help you in differentiating different things and in selecting the correct options in the exam, if someone is guiding you what to look for. But if you will gonna go and read this topic from books and text, you will gonna see there are long topics. You will not be able to even retain anything at the end. Okay. So the next topic, the next major term is frontotemporal dementia. So always remember, this dementia, it has a familial inheritance, autosomal dominant inheritance. It can present as autosomal dominant. So it has some genetic factor in it as well. Okay. Though Alzheimer's has as well, but this has common inheritance. So frontotemporal dementia, and this very important. This is a very, very important MCQs in MRCP. Though this is the thing that it's not conceptual, because I told you they will gonna assess your basic knowledge as well. So this will come in the exam. Frontotemporal dementia start initially. There will be options: orbitofrontal cortex, temporal, and parietal. So the option will be orbitofrontal and anterior cingulate region. Okay. So we will gonna discuss the major disease in the frontotemporal dementia, which is the Pick's disease, and which usually comes in exam. It has also two other things. One is progressive non-fluent aphasia, also known as chronic progressive aphasia, and semantic dementia. But this one is important, Pick's disease. So what is the common feature? How the patient presents in frontotemporal dementia? Onset before 65 of age. Like if a patient is less than 65, think of temporal dementia. The most important thing that you will gonna recognize that this is frontotemporal dementia, it is the personality changes and social conduct behavior. Very important. Personality changes. What do I mean by personality changes? Personality changes mean that the patient will be abusive, passing bad comments, and antisocial behavior. Okay. But you can see that in this, relatively preserved memory and visuospatial. The memory will be preserved and the visuospatial skills will be preserved, but the major problem will be with personality changes and conduct problems. Okay. So this is Pick's disease. Okay. Pick's disease is characterized by personality changes and impaired social conduct. Disinhibition means that antisocial. Okay. The patient will be having increased appetite, preservation. Okay. Preservation. Then there will be what you will see on the MRI scan. There will be a question in which they will be saying that a patient died, then further his autopsy was done, and in autopsy it was seen that there were knife blade appearance. Knife blade appearance is characteristic of Pick disease. This is what you have to remember. Knife blade appearance, Pick disease. Personality changes, Pick disease. In disinhibition, Pick disease. Okay. And there is a combination of top protein. So the last major dementia which I wanted to discuss with you is vascular dementia. Vascular dementia, what you have to remember is that in vascular dementia, you will gonna have a stepwise progression. It will not be immediately, it will be step by step, like this. Getting worse slowly, step by step. There will be history of strokes, and there will be presence of neurological signs. The patient will be having problems, vascular problems before, diabetic, hypertensive, maybe having strokes previously, and later on in their life they present with this dementia. So it is vascular dementia. Okay. There will be MRI scans will be some multiple lacunar infarcts, because it is a vascular disease, and there will be strokes, history of strokes. So whenever there is a stroke, there will be infarcts. So infarct will appear on MRI scan and CT scan. And it does not respond to anticholine esterase inhibitors such as donepezil. Why? Why? Because the pathogenesis is not the the acetylcholine esterase. The pathogenesis is the infarctions. So why the donepezil will work? There is no relationship with it. Okay. So that's how it we can put it, because the infarct the pathogenesis is because of infarct, then no need of donepezil. Donepezil will not work. Acetylcholine are normal in this patient. Only the infarct are the reason for the dementia. So that's how it works. Okay. So what is the treatment for it? The treatment is memory therapy. And what is memory therapy? We will ask the patient to solve math questions, to recall past things, to recognize images. We will make the patient brain work. So in that way, the patient memory will get better. Okay. And you also have to reduce the risk factor of cardiovascular problems. So that what is vascular dementia. Okay. Just a very, very quick recap, and then we will gonna go into the questions. So in Alzheimer's, as I have told you, it is a short-term memory loss. Okay, there will be amyloid plaques. In dementia, there will Lewy body dementia. There will be visual hallucination. There will be Parkinsonism. Okay, and neuroleptic sensitivity, like no antipsychotic drugs, contraindicated. Alpha synuclein nucleus will bodies will be present in here amyloid, in Lewy body alpha synuclein. Frontotemporal dementia, disinhibition, compulsive behavior, behavioral changes, personality changes. Remember, personality changes, always personality changes. Okay. Atrophy of the frontal and the temporal region of the brain. Vascular dementia, and it will be because of the vascular events that we will be having. So guys, I'm gonna unmute you guys, and I'm gonna ask you about the questions, and you guys will have to answer all of those. Okay. So please read. I will read the question. I will read the option, and you guys will gonna answer it. Okay. And I'm gonna tell you guys, these questions are from the past papers. And after I have told you about everything, and I have told you dementia. So you will gonna guys will see that how easy it is to pick up those points in the question that will gonna help you in the exam. Okay. So I'm gonna need answer from you guys. A 78-year-old man with a memory impairment, hallucination, resting tremor, and fascinating gait, and an expressionless face, a score of 12 into 30 of mini-mental skill. What test is most likely to confirm the diagnosis? MRI scan, CT scan, brain biopsy,
Lewy
or
body
genetic
dementia.
testing?
PET scan.
Lewy body dementia, SPECT scan.
SPECT scan.
Exactly. Very good. SPECT scan, because you can see hallucination, you can see resting tremor, gait, and expressionless face, Parkinsonism, and dementia. Three things: dementia plus Parkinsonism plus hallucination, Lewy body. And investigation of choice, SPECT. I hope that makes sense. Okay, guys. A patient is having history of Parkinson's symptoms, agitation, deteriorated after prescribing haloperidol. What is the most likely diagnosis?
Lewy body dementia.
Exactly. Lewy body dementia.
Lewy body dementia.
Lewy body dementia. Haloperidol is an antipsychotic.
Neuroleptic antipsychotic.
Yes, antipsychotics are contraindicated in Lewy body. It will gonna make the patient's symptoms worse. Okay? Are you guys following me? I need responses. I need responses from you guys.
Yes.
Yeah, it's okay.
Yes.
Great. So what is the next question? A 75-year-old patient with a history of dementia dies suddenly at home. A post-mortem reveals her having a Lewy body dementia. The Lewy body is made up of, tell me.
Alpha-synuclein.
Alpha-synuclein.
Probably alpha-synuclein, yeah.
Great. Alpha-synuclein. That's the answer. Okay. So guys, these were the easy questions I just mentioned early first. Now we're gonna go into some more difficult questions, which so you guys can get questions like this as well. So you can see that if you are already going for MRCP, you have to retain a lot of information. How you will gonna retain that which neural protein was there in Lewy body? You might, I don't know, it was amyloid, it was alpha synuclein, because you haven't read it in that way. You haven't focused in that way. So when all of the course will get accumulated, these things will gonna matter, and you will gonna get such questions as well, based on the pathology, based on the pathogenesis, based on the side effects. Okay, so here we go. Let me read the question for you guys. A 64-year-old school teacher is referred with progressive gait disturbance, fluctuating confusion. His symptoms began about 2 years ago. Notice heaviness in the legs on walking to work. Since then, his handwriting has become untidy. His wife reports that he has become increasingly forgetful at home, although he denies this. Over the last 2 months, he has become restless at night and has reported seeing unidentified object moving on the walls. On examination, his mini-mental state is 24/30. He is symmetrically rigid and shows some mild jerky tremors. What is the likely diagnosis?
Lewy body dementia. Dementia with Lewy bodies.
Great. It is dementia with
Lewy body
Lewy
dementia.
body. Guys, look at it. Look, see, this is how
Real
MRCP
hallucination
questions are designed.
and
You have to read between the lines. You have to know that only if you will gonna know the exact features of the disease, only then you will gonna recognize it. Gait disturbance, Parkinsonism. Fluctuating confusion, dementia. He is unidentified object moving on the wall, hallucinations, visual hallucination. So all the three things are completed. You can also add Parkinsonism, rigid and slow jerky tremors.
memory loss, early
So
memory loss.
dementia, Parkinsonism, visual hallucination, Lewy body. Okay? Did you guys get it?
Yes.
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 Great. So this is how you read the question. This is how you interpret the question. Okay? This is Lewy body. Next question, please. A 83 years old woman is brought to the clinic by her son. She lives independently, but her son noticed that she's more forgetful over the last 6 months, and there is no neurological abnormalities on examination. Which of the following feature would most support a diagnosis of early Alzheimer's disease? Disinhibition, drowsiness, initial long-term memory loss, visual hallucination, word finding difficulties.
Word finding difficulties.
So guys,
Word finding difficulties.
exactly, excellent.
Word
Finding difficulties. I have categorically mentioned that it will be an early short-term memory loss, and there will be word finding
difficulties.
deficiencies because of the loss of temporal degeneration. Okay, so the answer is word finding difficulty. Next question. A 60-year-old man present with 6-month history of personality changes, disinhibition, altered dietary habit. He lost his job because of inappropriate social behavior. There is no memory deficit.
Frontotemporal dementia.
Frontotemporal dementia.
Well done.
Personality changes.
Frontotemporal dementia, personality changes, disinhibition,
Inappropriate behavior.
and inappropriate behavior. That all gonna lead to the frontotemporal dementia. Very good. Okay, next question, guys. A 70-year-old man is brought to the clinic by his wife. Over the past 9 months, he has suffered a slowly worsening poor memory, unsteadiness of his feet. Most recently, he has developed urinary incontinence. He has a history of hypertension, for which he is treated with the ramipril and amlodipine, and he drinks 2 large scotches each evening to help him sleep. On examination, his blood pressure is 150/82, pulse is 80 beats per minute and regular. He has a mini mental state score of 24/30, particularly poor working memory, slowness of thoughts, and gait apraxia. Reflexes are brisk. Investigations are all normal. Which of the following fits in the pictures? Alzheimer's disease, depression, vascular dementia, normal pressure hydrocephalus, or Wernicke-Korsakoff syndrome, which is also known as alcohol.
Vascular dementia. It will be vascular dementia.
No.
Okay, guys.
Normal pressure.
Sorry?
History
Normal
of
pressure
hypertension for
hydrocephalus.
old age vascular dementia will be.
Okay, one is the vascular dementia. Any other option?
Normal pressure hydrocephalus.
Yes.
Okay, normal pressure
Vascular dementia.
hydrocephalus.
Normal pressure.
Brisk reflexes.
Okay. Anyone else?
Vascular dementia.
Okay. So guys,
History of hypertension.
okay. So guys, listen. This question, I have added this question just to show you guys that dementia is not a short, it's not a small term, it's an umbrella term, and I haven't touched a lot of it. I haven't touched like most of the things. I haven't even touched, and I haven't even taught you guys. Okay, so that's what I just wanted to tell you, that the topics which I taught you, you already knew that these are the options and you selected them correctly. But this topic I haven't taught, like it was not mentioned here, but and you guys were not able to diagnose it. Okay, so the answer in this is normal pressure hydrocephalus. Normal pressure hydrocephalus is also associated with dementia. See, this is how the MRCP exam questions come. Like there is dementia also, there is a history of urinary incontinence, there is a history of hypertension, which will be going towards the vascular dementia. There is a history of 2 large spots, which goes towards Wernicke's encephalopathy as well. Alzheimer, dementia, okay, depression is out of the way. Then there is vascular dementia as well and Alzheimer. So guys, this is why I'm always stressing on this thing, is that you really guys need that, what you have to look for in the STEM. Okay, so in the normal pressure hydrocephalus, what usually happen is that there is a triad: gait disturbance, memory loss, and urinary incontinence. If you guys will gonna find these three things, in the STEM, you will close your eyes and you will circle normal pressure hydrocephalus. See, there is also dementia in this. And let me tell you, there will be a question in which there will be a patient who will be drinking a lot. Okay, and there will be a triad for Wernicke's encephalopathy as well: nystagmus, ataxia, and dementia. So every disease has certain catching points. They are really interrelated. So you have to look between the lines, and you only need, because when you will gonna read them all together, you definitely will gonna forget that what was for what was for what. So that's how we are here to help you guys. So I haven't told you about this, but this disease, I just wanted to tell you that it is, like, you can say it is vascular because blood pressure is high, he is having hypertension, and he's old age, so it can goes to vascular dementia. But no, there are certain other important things in the STEM, like gait disturbance, urinary incontinence, and there is memory loss, which is dementia. So this triad is particularly specific for normal pressure hydrocephalus. Okay, so guys, very thanks to all of you for bearing me for so long. And I'm sorry this was a very long presentation, because it was presentation as well as it was the, what you call it, the a presentation for the dementia, because I just wanted to tell you guys that how we're going to help you. So your feedback, your questions are very welcome, and the floor is open. Please go ahead one by one, and let's just finish it and wrap it up really fast, because it's already 2 hours and 15 minutes. Any question, any suggestion?
Are these topics are included are in present in our past medicine?
These topics are all from your past paper, like these topics which I have selected. Only this is only, you can say, 1/4 of the dementia. Okay, and this is included in your MRCP exam, and it is included in past medicine. Okay, but in past medicine uh, they haven't specified the catching points, like I have told you, and I have, it will be like a whole topic, and you will have to read whole of it. Okay, and you will have to attempt the question for it. But the way I have told you that you have to look for these things, it's not mentioned anywhere.
Sir, if you only focus on past medicine, is it enough for passing the MRCP exam? MRCP exam.
Past medicine is, if you will read it correctly, if you will read it with concept, and if you will look for the important points which you have to look for in exam, you will definitely, but the revision, you will gonna pass it.
Sir, how much approximately we need to correct to pass the exam?
Sorry?
How much questions approximately we need to pass the exam?
It depends upon the exam. If the exam is difficult, but the approximate is 128.
So what will be the percentage of passing percentage?
More than 60%. You need more than 60% to pass in MRCP Part 1.
Both exams 60%, right? Paper 1, paper 2.
Combined, yes, combined. Like your score should be more than 542, 545.
Okay.
Sir, please repeat this passing score again.
Passing score in MRCP is equivalent. Every exam will have a different passing score, but approximately the passing score is around 60%. You have to score 542 to 545 marks, 545 marks approximately. More than that, more than that. These are the cutoff limit.
Thank you, sir.
Any other question, any suggestion, please?
Can you please summarize vascular dementia? Thank you. Just in a short, because yeah, I just have a doubt.
In vascular dementia, actually, in vascular dementia, what you have to do is that you have to look for any previous history of vascular diseases, any diabetes, hypertension associated with previous strokes, associated with previous weakness in any part of the body, and it will be there will be a proper history of the previous stroke. Patient is the patient has weakness of one side of the body, or the patient is recovering from stroke, or the patient is having difficulty in speech, patient is having difficulty, he has a stroke and he has developed difficulty in swallowing, he has lost his gag reflex. There will be a cut-off history for this vascular problems in the patient. And patient will also be having comorbidities like previous MI, previous stroke with diabetes and blood pressure, and the patient's dementia will be stepwise, like worsening over the period of time.
Thank you.
Anything else, guys? Any question?
Sir, kindly brief about the PACES exam.
Sorry?
Sir, PACES, you didn't explain it.
Yeah, PACES is a very big domain, and we can arrange a seminar sometime else, because it's a very different exam. It's a very separate domain, and you have to go into detail of everything. It's a clinical exam. You will be having examination stations from neurology, abdomen, respiratory. You will be having communication skills scenarios. You will be having ethical scenarios, a total of 5 stations. Okay, and it's a one-day exam, and you will be marked on the basis of, and you will be having the patients there. You will be doing everything on the patient, with the patient. The examiner will be sitting on a side, and the examiner will be marking you for that. You will not, maybe in the end the examiner will ask you questions if he wants, but most of it is a totally clinical exam.
So it would be on a real patient.
Yes,
Examination
yes,
will be.
yes, yes. Any other question, guys, or we should wrap this up? I think you don't have any questions, so we will gonna wrap this station up. Thank you so much, guys, for bearing me, for being here with me, and I hope that I was of any help to you guys.
Excuse me, sir. So, sir,
Yes.
excuse me. Can you please tell me about the crash course or the mentorship program that is available?
Sure. You can. We will gonna give you a number. I'm gonna post a number in this chat group. Okay, and whatever queries you have for the crash course, you can WhatsApp them, and they will gonna guide you very perfectly about that. Okay.
Oh, okay, sir.
So I'm gonna write an email address, as well as I'm gonna give you the number for it, and you will gonna ask any queries you have, anything you want to ask. Okay. Okay, guys. Anyone will respond me or not?
Thank you, sir.
Yes, sir.
Yeah,
Okay. Okay. So I'm gonna post the number, and you guys will be seeing it on my screen as well. So I'm gonna post a number. Can you guys?
Sir,
Can you guys please? Can you guys
again, a
please?
doubt, sir. Actually, are you going to take the classes or anybody else is going to take?
I will be the one taking the classes. I will be the one mentoring you guys.
Okay, thank you.
Welcome. So I hope that you have got the number, and whoever was asking for the number. I'm really sorry. I have this question. Which one is easy to clear, MRCP UK or Ireland? The preparation will be the same. Tell me about the study material, notes, and books. And so I have already told you about the MRCP UK. So MRCP UK is tougher than the Ireland exam. Ireland one is easy. Okay, so if you have done MRCP UK and you want to get MRCP Ireland as well, so you just, if you have completed your MRCP UK, you will just have to appear in the third part of the MRCP Ireland. You will not have to sit in MRCP 1 and 2 of Ireland, and you are exempted from it. That's the power of MRCP UK. You will just have to clear the clinical part, and in the clinical part, it will be much easier than MRCP UK clinical part. So you will gonna get both MRCP UK and Ireland. I hope that makes sense. So guys, if you don't have any question, I'm really gonna end up this session now, because it's already 2.5 hours and I have been speaking a lot. So thank you so much for being a very good audience, and thank you so much for everything, for your time, for your patience, and I hope I was of help to you guys. And very best of luck to you guys for your future endeavors. And if you guys have any queries, anything, you can ask that on the number I have posted. Okay, save this number, and very good evening, good night, and have a very good rest of your day. Thank you so much.
Thank you, sir. Thank you a lot.
Thank you, sir.